Biological theories of aging indicate that, although biology places some limitations on life and life expectancy, other factors are subject to behavior and life choices. Nursing can help individuals achieve the longest, healthiest lives possible by promoting good health maintenance practices in a healthy environment. Psychosocial theories help to explain the variety of behaviors seen in the aging population. Understanding all these theories can help nurses recognize problems and provide nursing interventions that will help aging individuals successfully meet the development tasks of aging. Cultural, spiritual, regional, socioeconomic, educational, and environmental factors as well as health status impact older adults' perceptions and choices about their health care needs. Theories can predict patient outcomes hold the greatest promise for guiding nursing practice in ways that help each individual patient age successfully. When interacting with the older population, it is important to relate the key concepts of the biological theories to the care being provided. Although these theories do not provide the answer, they certainly can provide an explanation for some of the changes seen in the aging individual. Aging and disease do not necessarily go hand in hand, and the nurse caring for older adults needs to have a clear understanding of the difference between age-related changes and those that may actually be pathologic. When considering biologic theories of aging, two concepts have gained wide acceptance. 1. There may be a limited replicative capacity for certain cells that causes overexpression of damaged genes and oxidative damage to cells. 2. Free radicals may cause damage to cells over time. Based on these concepts, gerontologic nurses can promote the health of older adult clients in several ways. Using the biological theories, example 1. Cigarette smoking causes increased cell turnover in the oral cavity, bronchial tree, and alveoli. Smoking also introduces carcinogens in the body that may result in an increased rate of cell damage that can lead to cancer. Excessive exposure to ultraviolet light is yet another example of a substance causing rapid turnover of cells, which may lead to mutations and finally malignancies. To reduce free radical damage, nurses can advise clients to ingest a variety of nutritious diet using the food pyramid as a guide, and suggest supplementation with antioxidants such as vitamin C and E. Educate the client about the damage done by free radicals. Using the biological theories, example 2. Activity continues to play an important role in the lives of older adults. Daily routines help strengthen muscles and prevent further atrophy of muscles related to disuse. Nurses should assist with activities of daily living, ADLS. This requires functional use of extremities. Encourage daily exercises that enhance upper arm strength and hand dexterity, which contribute to older adults' ability to successfully perform dressing and grooming activities. Chair-based activities, like deep breathing, increase the oxygen flow to the brain, thereby promoting clear mental cognition, minimizing dizziness, and promoting stamina with activity. Encouraging older adults to participate in daily walking, even on a limited basis, facilitates peripheral circulation and promotes the development of collateral circulation. Walking can also help with weight control, which often becomes a problem in older adults. Additional benefits of walking include 1. Replacement of fat with muscle tissue. 2. Prevention of muscle atrophy. 3. A generalized increase in the person's sense of well-being. The healthcare delivery system is beginning to turn its focus toward disease prevention and health promotion. Older adults must be included in this focus. Stereotypic views related to older adults being too old to learn new things must be replaced with factual knowledge about the cognitive abilities of older adult. Although aging brings with it a decrease in the normal functioning of the immune system, older adults should not suffer needlessly from infections and or disease. Using psychosocial theories. There is variation among the elderly based on culture, life experiences, gender, and health and family status. Nurses need to know whatever similarities exist among the elderly care needs to be taken, not to treat them as if they are. Older adults respond to current experiences based on their past life encounters, beliefs, and expectations. If their typical reaction to stress, challenges, or fear is to disengage from interactions, then current situations often produce the same responses. It is within the nurse's scope of practice to identify maladaptive responses and intervene to protect the integrity of the person. Withdrawal by older adults may be a manifestation of a deeper problem, such as depression. By examining the past and being aware of significant events or even beliefs about health and illness, the healthcare provider can develop a deeper understanding of why these older adults act or believe the way they do. Older adults should be encouraged to engage in a life review process. This can be accomplished using a variety of techniques like reminiscence, oral histories, and storytelling. Looking back over life's accomplishments or failures is crucial in assisting older adults to accomplish developmental tasks, as in ego integrity, to promote positive self-esteem, and to acknowledge that one did not live in vain. As nurses apply the psychosocial theories to the care of older adults in any setting, they help to dispel many of the myths about being old. If an older person is talking about retirement, worrying about physical living space, or even planning funeral arrangements, these are all part of the developmental tasks appropriate for this age group. Instead of trying to change the topic or attempting to help the person not be so morbid, the nurse must understand that each stage of life has specific developmental tasks to achieve. Instead of hampering, the nurse should attempt to facilitate their achievement. A younger person can gain much by observing older persons, listening to how they have coped with life experiences, and discussing their plans for the future with them. Employing Maslow's theory, the nurse recognizes that the essential elements such as food, water, oxygen, elimination, and rest must be met prior to self-actualization needs. The nurse recognizes, for example, that client education will be more successful if clients are well rested. Carson, Arnold, 1996. In planning activities for older adults, nurses need to remember that all individuals enjoy feeling needed and respected and being considered a contributing member of society. Perhaps activities like collecting an oral history, creating a mural, or quilting a particular event or even an individual's lifetime could be included. Not only would this activity be valuing the individual, but it would also serve to pass on information from one generation to the next. This is an important task that is often forgotten. It is important for the nurse to acknowledge the spiritual dimension of a person and support spiritual expression and growth. Hogstel, 1995. Spirituality no longer merely denotes religious affiliation, it synthesizes a person's contemplative experience. Illness, a life crisis, or even the recognition that our days on earth are limited may cause a person to contemplate spirituality. The nurse can assist clients in finding meaning in their life crises.